Northeast Tonight, brought to you by Oil India Limited, conquering newer horizons.
Hello and welcome to Northeast Tonight, the show that decodes the region. It is now 4 months since coronavirus first broke out in China's Wuhan city and has since spread across the world. More than 100,000 people have died and about 2 million affected by the deadly virus worldwide. India too has been hit by COVID-19 with the number of positive cases racing towards the 10,000 mark. And more than 300 people have died. The question that everyone is asking is simple. When will the coronavirus pandemic end, or when would the world be able to control the spread of this deadly virus? This brings us to yet another oft asked question. Is an accepted treatment protocol been developed, and when will the world possibly have a vaccine to prevent coronavirus attacks? Like all frontline workers, clinicians and other medical doctors examining patients on a day-to-day basis in private clinics are in great risk. What do they do post-COVID when somebody visits them complaining of fever, for example? To answer some of these questions, I am joined tonight from Newcastle in the United Kingdom by Dr. Jayanta Biswa Sharma, a consultant microbiologist and infection control specialist with the National Health Service of England. Dr. Madhumita Priyadarshini Das, Professor of Medicine at the Guwahati Medical College, is with me at the studios. Dr. Rifat Mannan, Assistant Professor of Pathology at the University of Pennsylvania, joins me from Philadelphia, the United States. And also at the studios, I have a very senior physician, Dr. Bharat Bhushan Kukreja, from Guwahati. Ladies and gentlemen, welcome to Northeast Tonight. I'd like to go straight to you, Dr. Jayanta Biswa Sharma, joining me from Newcastle in UK. Dr. Jayanta Biswa Sharma, first of all, welcome. You see, the world is battling coronavirus for the past 4 months with no respite. We thought SARS was deadlier, but COVID-19 is so very infectious. So we have a bigger battle. Is that the correct perception?
I think I will slightly dispute your description that the epidemic is still kind of going on an upward trend. That in fact, if you look into the latest figures, in France, Italy, Spain, actually epidemic has reached its peak and it is plateauing, and we are seeing gradual decline in death rates. So, in fact, every epidemic, it goes on on its own kind of that it follows what is so-called epidemic curve.
Right.
The numbers goes up, reaches its peak, and it comes down. That is the natural course of an epidemic. But coming back to your question, why it appears that this epidemic seems like it is going on and on. This is actually not the case, as I explained. But what is happening, we are flattening the curve with all the measures that the respective governments are putting in place.
Right.
It's a draconian measures, like locking up cities for 3 weeks, never heard of before in case of any epidemic. And this is what is doing, it's flattening the curve. And one of the natural corollary of flattening the curve is that the epidemic takes longer to actually subside. So there is a trade-off there. We are not getting so many cases in one go, but nevertheless, we are getting the cases over a longer period of time. So that is what is called flattening of the curve. That's why it seems like it's going, on and on.
Okay. Dr. Jayanta Biswa Sharma, stay on, don't go away. Dr. Madhumita P. Das, I'm coming to you, Dr. Kukreja. How do you see, at which stage, it is 4 months, that's how we began this conversation, Dr. Madhumita. 4 months and the world doesn't seem to have a respite. In some of the countries like China, where it first started, it has sort of, become under control. India is somewhat, despite the numbers rising every day, India is somewhat under control, but the situation in countries like the US, the UK, Italy are still doesn't seem to be under control. So what is the stage? What level of the problem that you see today? What is the level?
The magnitude of this problem, Wasbir, has been very well addressed by our government. That is, first of all, I have to admit that. Our government has taken it up very early, I mean much before the US got an alert about the spread of the disease. India government took it up very well, more so our state. In our state, I would fail to, in my duty if I do not express my gratitude to our Honorable Health Minister, who's done it so well. It is the lockdown, it is the way that they are trying to contain the disease, they are trying to track the disease, that the level of spread has been controlled till this level. Had this not been done, you don't know what could have happened. This disease is spreading exponentially. US, with that population, with that much of distancing, with that density of population, they have reached that lakhs of figures. Look at us, we could have been somewhere else. It's our huge gratitude to the government, and more so in our state.
So that means, in a simple terms, Dr. Madhumita P. Das, you are saying that, basically you are saying that, lockdown was the key. The social distancing did the trick for India. Let's have everybody on the screen. So you said lockdown was the key.
Absolutely, I agree. For our country, with this density of population, to start with, lockdown is the key.
All right, I'll come back to you. Dr. Kukreja, a lot of people are asking this question. Now, viewers, I have an all medical panel on the show today. Everybody is a medical specialist. Now, the question is, Dr. Kukreja, everybody around the world, not just in India, all around the world, the one big question: when is coronavirus going to end? So, do you have any answer?
Thank you, Wasbir. The question is, when is going to end? If I just tell you, coronavirus has been existent, and what we are seeing today is a variant of the available coronavirus in the world. Now, since this is a new variant, genetically different variant of coronavirus, it's very difficult to just know about it, and as we are progressing, we are learning more about it. So, in the last 3 months, what we learned from China, then what we saw in South Korea, we have now been able to understand that one thing for sure, as my colleague said, that stop the progression by causing lockdown. And now there is no host. So, therefore, we are very sure that as time progresses, as Dr. Sharma mentioned, that in many of the countries they have already reached the plateau. The peak. So, now we are going to have a down trend of the infection, and as we are not available, as the virus is not going to get a host, obviously in due course of time it will have a natural regression, and in the meantime the population will develop the herd immunity. That is what we are waiting for, and hopefully we will have an effective vaccine also by that time.
So there are a couple of strategies now. The flattening the curve, many people are saying that holds the key, and lockdown is going to help in flattening the curve. By that time, if you can slow down the spread, Dr. Kukreja, perhaps a vaccine will also be there to assist us in our battle against the coronavirus. That is what basically you said. I'll come back to you. Let me go to Philadelphia in the United States. I'm joined by Dr. Rifat Mannan, associate professor, assistant professor at the University of Pennsylvania, a pathologist. Dr. Rifat Mannan, what is the novel coronavirus really? Because we had heard about various types of flu. Earlier it was the SARS that swept the world, and a lot of people said that SARS, the mortality rate, was much more than COVID or for that matter the novel coronavirus. But we cannot take the novel coronavirus lightly, because it has been turned out to be so much infectious, so very infectious. Rifat.
As we all know, the current pandemic or the COVID-19 is caused by a new coronavirus or the novel coronavirus, which is called SARS-CoV-2. In fact, coronavirus is known to cause outbreaks, and in recent past we had two major outbreaks in the world. In 2003 we had SARS, which started in China, and in 2012 we had MERS, which started in the Middle East. And if you compare these two, SARS affected about 8,000 people around the world and nearly 800 people died. So with a case fatality rate, you can say about 9%. The MERS affected around 2,500 people, and again nearly 850 people died, which had a case fatality rate of over 30%. But if you compare those to COVID-19, which seems to have a much lower mortality rate, like 1.5% to 3%, but if you look at the numbers, it is huge. As of today, over 19 lakh people have been affected by this virus across the world, and more than 1 lakh people have already died. And in fact, in US alone, till today, there has been over 6 lakh confirmed cases of COVID-19, and over 23,000 people have died. So as compared to the other outbreaks, COVID-19 has really outweighed the impact of both SARS as well as MERS. And as this is a new virus, more and more knowledge we are being able to know. And in fact, even though we know that the disease probably transmits by droplets alone, but there is recent data which suggests that probably the virus also transmits through aerosols. So that's why COVID-19 seems to be much more infective as compared to either SARS or MERS.
Okay.
And
Dr.
that's why
Rifat,
it is having a much broader impact across the world.
Much broader impact. Dr. Jayanta Biswa Sharma, I am coming to you. Dr. Madhumita, from what Dr. Rifat Mannan is saying, now he has given the figures. The SARS figures, 8,000 died around the world out of SARS. MERS, 850 deaths. And here, as far as COVID-19 or the novel coronavirus is concerned, we have already seen around 1,20,000 deaths all over the world. Now, what is going on? I mean, a lot of people are saying that, we should allow a herd immunity. There is no point in lockdown. That's one set of views coming like that. Now, question obviously with the people who would like to know, what is the treatment protocol, or has an acceptable or accepted treatment protocol emerged? That is my question. Has the medical fraternity come up with an accepted treatment protocol?
That's very difficult to say that we have an accepted treatment protocol.
Yeah.
But the Ministry of Health, Government of India, and ICMR, because I'm concentrating in our country, has given us a protocol by which we are actually segregating patients as mild, moderate, and severe, depending on certain parameters, clinical parameters, like the respiratory rate, the saturation of oxygen, I mean at what stage of the disease they are presenting to us, and accordingly we have the treatment that we give them. For mild cases, we are giving them symptomatic treatment with paracetamol, a mild antibiotic. There is a drug which all of you are familiar with, which is called oseltamivir, which is an antiviral, which is used for the common H1N1 flu, which is very common in this part of the year, and that is being given to almost all patients, and other whatever symptomatic we need to. So mild. As the patient goes into moderate and severe, we escalate the treatment until the patient may land up in the ICU.
Okay. Now, Dr. Jayanta Biswa Sharma, another question that everybody wants to know, which I think I asked Dr. Kukreja this, when will the world be able to control this virus? Because as we have heard that SARS took the lives of 8,000 plus people, MERS took only 850 lives, but COVID-19 has already taken 1,20,000 lives. 2 million people as of date are affected around the world. Question is very simple, like this is a justified question, Dr. Jayanta Biswa Sharma, when will the world be able to take control of the novel coronavirus? Any guess? Any suggestion? What is your guess?
Okay, it's a kind of a follow-up from your first question. In Wuhan, what we have seen, it took them about 10 weeks. So 4 to 5 weeks to reach the peak, then another 4 to 5 weeks to decline and basically epidemic to be totally controlled. And this is what we are seeing in France, Italy, and Spain. It took about 4 weeks to reach the peak. It is gradually coming down. So this whole cycle, empirically, what we have been observing is taking about 8 to 10 weeks, depending on countries. Obviously, it could be 8 weeks, 4 weeks upward, 4 weeks downward, or could be 5 weeks. So essentially, it is taking 8 to 10 weeks. And this is what is happening in America as well. In America, in different cities, obviously in America, it started with the New York City, and then there is a successive wave in different American cities. We are actually observing the plateauing. There is a hint that even in New York, it is plateauing. Again, it is about 4 to 5 weeks to reach the peak.
All right. So, Dr. Kukreza, what is your guess? I'd like to ask you pretty much the same kind of a question. We are talking about the treatment protocol. We don't know what is the wonder. Is there a wonder drug for this? Why is hydroxychloroquine so much in the news today? Why is a country like the United States, appealing to everybody? Oh, send us, huge quantities of hydroxychloroquine. What's going on? How will we be able to control this virus? Is lockdown the best option?
Okay, Wasbir, the question is a $1 million question. Let me first clarify, all patients who have COVID-19 do not have symptoms. 80% of people do not have a symptom, 80%, number one. The second fact is, many of them are asymptomatic for up to 14 days. They just do not have any symptom whatsoever. If, like in Korea, they screened everybody and found many people who were positive. What they did? Treatment? No treatment. Just put them on quarantine, home quarantine, 14 days. Gave them guidelines. If you have a symptom, report immediately. So that is one way how you manage COVID-19. If patients are symptomatic, as my colleague just mentioned, if they have got acute respiratory distress, then obviously patient requires first is a rescue medication.
Yes.
And let me at the outset tell you, there is no treatment. Treatment is absolutely symptomatic. You treat what it comes. And the second point which I will tell you is why this virus is creating a havoc is it makes the whole body, puts the whole body, all systems on fire. The cardiovascular system, the respiratory system, the GI system, the hepatic liver system, and the hematological system. So at one point of time, all systems are on fire. What are you going to manage? Acute MI, acute respiratory failure, or gut failure. So therefore, the approach is one, prevention, prevention, prevention. That's what my colleague said.
Prevention, prevention, prevention. And that is why a country like India is going all out with their strategy, that is lockdown, and trying to enforce the lockdown. That is perhaps the best way in the absence of a vaccine so far is to prevent. Let me go to Rifat Mannan. Rifat, we are talking about a treatment protocol. Now 1,20,000 people dead, 2 million affected. So these 2 million people will be expecting treatment, isn't it? As Dr. Kukreza said that, the entire lot of systems within the human body is under fire. Which one are you going to control? So treatment is the key, but how do you treat? So that brings us to the question of treatment protocol. Dr. Rifat Mannan.
Though I am not personally involved in treating COVID-19 patients, what I understand is that the treatment modality varies from patient to patient depending on disease severity. Those patients who are having mild symptoms, and luckily they are the majority, they are asked to stay home and in isolation, and they are asked to take medications for fever or cough as it is necessary for them. And those with severe symptoms, especially those with breathing difficulties, they are admitted in the hospital, and some of them may need to be treated in the intensive care unit, where the main goal is to increase the oxygen flow, as we know that this disease mainly involves the lungs. And in the ICU, it is mostly supportive measures, and several drugs have been tried with varying results to treat COVID-19, such as hydroxychloroquine, azithromycin, and some antiviral agents as well. Recently, there has been a lot of interest in another modality of treatment, which is known as use of convalescent plasma, which means that to use the blood plasma of patients who have recovered from COVID-19 and use this plasma to treat new patients. And in fact, those patients who have recovered from COVID-19, their blood develops antibodies to the disease or to the virus, and it is supposed to help patients when they are treated with this plasma. And in fact, this modality has also shown promising results in recent times.
Okay, Dr. Madhumita P. Das, Dr. Rifat Mannan is basically talking from an academic's point of view. He's talking about what is the research going, what are the new approach to treatment. But on a mass scale, what is the situation in the world? Why do you think is a country as developed as the United States is talking so much about this drug called hydroxychloroquine, which is which is being used in India for ages, for decades together to control malaria? It's just thought to be a very mundane kind of a drug as far as the Indian context. I'm talking from the normal Indian point of view. So why do you think so much of interest in this drug, and overall, how do you approach a severe patients who get afflicted with COVID-19?
So there are two parts to your question. One is about hydroxychloroquine, one is about the severe illness. Now, talking about hydroxychloroquine, hydroxychloroquine is a refined form of chloroquine, which is an antimalarial, which, as you've already said, has been used for ages in India. But hydroxychloroquine has got many other effects as well. It's an immunomodulator. It modulates the immune response of the body, and so far as this particular virus is concerned, this virus actually binds with the red cells. So it blocks the binding sites. So hydroxychloroquine is known to have some effect on the treatment of this disease. But how effective, time is going to prove. But it's beyond an antimalarial. But there are buts to it. That is, you cannot use hydroxychloroquine in a person who has heart block. So you need to essentially do an ECG and see if there is a heart block. We don't give hydroxychloroquine. Second, there is a condition called G6PD deficiency, which is pretty common, especially in this part of the globe. That means the red cells has an enzyme called glucose-6-phosphate dehydrogenase. There are many people who are deficient on this enzyme, so we need to look into that before we start hydroxychloroquine. Otherwise, hydroxychloroquine may perhaps have some effect in mild to moderate patients.
Okay.
Can I?
Yeah, Dr. Kukreza, yes.
As Professor Das has said, hydroxychloroquine has been used as number one, preventive drug, number two, as a therapeutic medicine. ICMR has given guideline that those people who are taking care of, those healthcare personnel who are taking care of known case of COVID are to take, they have to take this medicine, their immediate contacts, and only the family members of those who have got a proven swab to have this disease. So this is for them, for giving them we are presuming that we'll give them a prophylactic preventive strategy besides the full gear dress using all the preventive methods. This is one of the chemoprophylaxis which has been agreed upon by ICMR. This is so far as prevention is concerned. So far as treatment is concerned, as I mentioned earlier, there is no definite treatment, but in many of the protocols, like in Rajasthan, SMS Medical College, they treated those two Italian pair, the couple, using hydroxychloroquine, and the results were good. But that does not mean that this is the treatment.
You are talking about the Sawai Man Singh Hospital in
Jaipur.
Jaipur, yeah.
So hydroxychloroquine is being given, but the evidence level is still very low.
Okay, I'll have to go for a break, but before that, Dr. Jayanta Biswa Sharma, now you know many are saying that this virus, the novel coronavirus or COVID-19, will remain perhaps forever, and that we have to survive with this like any other flu. This is just one addition to the list of flu. So what is the road ahead according to you?
You see, that is a speculation, and I kind of I kind of agree with that speculation that COVID probably would be just one more flu virus to deal with. As we know, every winter in Northern Hemisphere, all the Western countries in Northern Hemisphere, they have to deal with flu epidemic. We don't hear about flu epidemic, but flu epidemic happens every year. Then from August onwards in Southern Hemisphere, in Australia, flu epidemic would start. So flu epidemic kind of, oscillates between Northern and Southern Hemisphere. It is fact of life. Nobody discusses about flu epidemic, but every year during flu epidemic, we see spikes, we see increased use of hospital capacity. Always there is a strain on resources during flu epidemic. So now we are having to deal with yet another kind of epidemic, which is corona epidemic. And my gut feeling is that it is going to stay, and probably it would probably exactly behave like the flu virus. So it is going to be one more addition to our kind of one more addition to fight with.
Absolutely, we have to wait and watch as to how things pan out in the coming days. We'll go for a short break. Viewers, don't go away. I'll be right back. We have an eminent panel of medical specialists to discuss some of the oft asked questions on the coronavirus. Welcome back. Let me go into a different dimension of the problem. Let me begin with Dr. Bharat Kukreja. Dr. Kukreja, you are a private practitioner. You practice at your clinic. Now, a lot of people come to visit you. A lot of people, that the question I'd like to pose is that, now, how difficult things have become for you after COVID? Because somebody may just go, I'm having headache, I'm having fever. Then who knows, that person may even be having symptoms or even be afflicted with COVID-19 really. Because you are a clinician, you cannot test and then check your patient. So what are some of the practical difficulties that you are having to face now?
Thank you, Wasbir. This is a question which is very difficult to answer, because people have in our society, in our culture, a lot of respect for doctors. Be what be, whether he has got a cough, whether he has got pain in the abdomen, he goes to his physician. Now, we have learned our lessons that any irresponsible or any carelessness can be very, very put both the doctor as well as the patient and the people who are waiting into a big challenge for their life.
Now, if I rephrase my question, suppose somebody comes to your clinic and says that I am having fever, how will you respond?
Well, that's what I said. Medical science is just not science, it's also an art. And you just can't say, if you have fever, please come day after tomorrow at 12 o'clock.
Or you can't ask him to get a COVID test done and then come.
No, COVID test is not possible, because there are guidelines who should be asked to get this test done. So if a patient has got fever, he has to I have to talk to him. Now, I'll have to reorganize my clinic. I will have to have people who would be giving me support. There are no compromise with the basic guideline, that is called social distancing. They should keep their distance away. Anybody who has got cough and fever should put on a mask when he enters the clinic, and at any point of time, not more than 3 to 5 people in the clinic.
Right.
No long waiting times.
No long waiting times. So, lot of reorientation necessary. Dr. Mudumita P. Das, now you are a professor at the Guwahati Medical College. You have usually in the normal circumstances, you have your OPDs, outpatient departments. Now, of course, the Guwahati Medical College has been converted into a full-fledged COVID hospital. There are no normal patients which are going to the private clinics and hospitals. That's a different issue. But in a normal case now, post-COVID, What do you think the world is going to change after COVID? The way how you used to treat patient, used to, the patient-doctor relationship, always, doctors go all out to treat their patients. You check very closely, there's close proximity between the doctor and the patient. So how are things going to be? What is your prediction? Or what is can you explain to our viewers what are the possible scenarios?
I don't really think that there's going to be a big change in the doctor-patient relationship, because we have guidelines, whether it's COVID or non-COVID.
Personal protection will increase, do you think?
Unless it's an infective disease that we have been doing for tuberculosis.
No, but how will you know when somebody comes to you with fever? That's the question I was asking Dr. Kukreja. Yes. Somebody comes to you with fever and headache. That person may not be having COVID at all.
Absolutely. You're very correct.
Yeah.
That, of course, we will have to be careful, keeping COVID in mind, like all other fevers as well. But we have the protocol as well till today, since India is in stage 2, not yet in 3. So if there is a travel history, if there is a history of contact with a positive case, those are the guidelines that we are still following even today. Those are the cases whom we are asking for COVID testing. So I don't think post-COVID, when the graph has flattened and there is a development of herd immunity, and in over a year from now, I hope there's going to be a vaccine which is going to be very effective. I don't think that's going to really change our practice. We have been careful, we will continue to be careful.
Can I add something?
Yes, go ahead.
One thing I'll put in a note on in my clinic: do not panic.
Do not panic.
Don't worry. If you have COVID, don't worry. You're not going to die.
I think that is a very good reassurance, Dr. Madhumita Pidas. Even if you are having COVID, you are not going to die. That is the reason why our Prime Minister and in Assam our Health Minister has been repeatedly trying to emphasize one point, that please do not panic. So yesterday, Meghalaya had its first COVID patient, who is incidentally a doctor in a prominent city hospital in Shillong. Now the first thing that the Chief Minister Conrad Sangma there said in his first statement is asking the people not to panic. Dr. Madhumita, your thoughts?
I mean, there's nothing to panic. The mortality is less than 5%. It's about 3.54. And the mortality is more so with people with comorbidities in the elderly age group. 60 plus or maybe 55 plus who's got diabetes, hypertension, other problems.
Yeah.
Those people who are immunocompetent, 80% of the infection goes unnoticed and you just develop an immunity. So it's only that small section of people whom we need to be careful about.
Okay, when we are talking about the mortality rate, let me once again go back to that question, Dr. Rifat Mannan. You are in the US and, at the highest level, that is the level of the American president, having a conversation with the Indian Prime Minister, having a communication with the Indian Prime Minister, what is he asking? He is asking for hydroxychloroquine. Now, I mean, what's going on? What do you have to say? A lot of people say that US is a superpower, and today when you are in the middle of a huge crisis and the president requests India to send consignments of hydroxychloroquine, and when it is being sent, he expresses huge gratefulness in public. 4 times in the span of 48 hours, President Trump thanked India. Thank Prime Minister Modi. Rifat.
It's an overstatement to say that hydroxychloroquine is a wonder drug in treating COVID-19. As we know that this drug has been primarily used for treating malaria as well as some other ailments such as SLE or rheumatoid arthritis. So there has been some data coming from China as well as France which has shown that this drug is useful in treating COVID-19, but those results were based on small number of patients.
Right.
And even though the drug has been approved for use in India and in US and some other countries as well, we still do not have robust data to say that this medicine is actually useful. So we have to be cautious, and in fact one needs to be aware that hydroxychloroquine can have severe side effects. It can cause major cardiac side effect leading to cardiac arrhythmia and sudden cardiac death. It can also cause major visual abnormalities. So till we have enough data, it is difficult to say that it is really effective in treating COVID-19. And in fact, there has been some clinical trials which are started in many countries, including the US.
Right.
And we will know how effective this medicine is in treating
Absolutely.
COVID-19.
We'll have to wait for this clinical trial results. Yes, Dr. Madhumita P. Das, you wanted to say something.
I just wanted to say this. Rifat has said that yes, we use hydroxychloroquine for months and years in patients who have systemic lupus and in rheumatoid arthritis. And there was a look into the data of patients who are already on hydroxychloroquine for their primary illness and they developed COVID, they did not show any better response. So there remains the question, the huge note of interrogation regarding hydroxychloroquine and COVID-19.
And Dr. Madhumita says huge note of interrogation, and Dr. Rifat says it's an overestimated drug. We have to wait and watch as to how things pan out. What is the wonder drug actually to deal with COVID-19? Let me go to you, Dr. Jayanta Biswa Sharma. Again, UK has been, one of the most worst affected nations as far as the novel coronavirus or COVID-19 is concerned. How is the UK treating the patients? Has UK come up with a treatment protocol or a treatment regime?
You see, controlling an epidemic is there is a natural way of controlling the epidemic, which is, we have often heard about the so-called herd immunity. When in a population about 80% of the people are immune, then there is a herd immunity, and herd immunity can be developed by natural way, by way of having a natural infection, or by way of a vaccine. So, in regards to vaccine, if you look at the WHO website, you will see more than 60 vaccine candidates are being developed, and there are different strategies. I'm not going to go into the vaccine strategies, but it is suffice to kind of appreciate that the large number of vaccines are being developed, but only 2 of them are in clinical trial at the moment. As you know, vaccine development takes in phases, it takes time. So realistically, I think there's a very optimistic outlook that probably we will have a vaccine in September, but I really doubt that. Realistically, we are going to get a vaccine probably past this winter, coming winter, January, February time 2021. And in terms of medical treatment, there are some repurposing of existing drugs. We don't need perhaps a new drugs. New drugs would take even more than what vaccine development is taking place. So what the effort at the moment is to repurpose existing hepatitis and HIV drugs. And there are some encouraging results. And I believe that probably we will have some treatment protocol within next 3-4 months, being validated by way of clinical trials.
All right. So those are very interesting points coming out. We don't perhaps need a new drug. We might have to, rework on, re-strategize our existing medicines and see what works actually, whether HIV positive drugs used to treat HIV can be used. But that's a matter of debate at this point in time. Nothing concrete has emerged. We'll have to wait and watch. Dr. Madhumita, a lot of people are saying that, okay, Indians have a bigger immunity than people outside. And a lot of people are saying that, well, India had a massive campaign to control tuberculosis at one stage. So the BCG vaccine was given. So that is now working wonders. Therefore, the Indians have developed a bigger immunity, greater immunity. And so the number of, COVID patients positive in India is less. Do you buy this argument?
See, I have also read about the BCG vaccine having some effect on immunity with COVID-19, but they are very small studies. I don't think that they are really effective. As of now, the fact that we are containing the disease to this level is all because of the lockdown at the moment. And there's another thing that I wanted to add regarding treatment. According to our protocol, whatever we have developed in our part of the state, we are using 2 antiretroviral drugs, lopinavir and ritonavir combination, which is available for the HIV positive patients, and those patients who have gone back home cured, even from moderate to severe disease, have received this.
Okay.
while in the hospital.
So are we saying, Dr. Bharat Kukreja, that antiretrovirals is also a treatment line as far as COVID patients are concerned, critical patients are concerned?
See, we are talking all theory. So long as you learn what is the behavior and what is the genetic setup of the corona, this 19 virus, it is very difficult to just imagine that can we use a drug which we use for hepatitis B, hepatitis C, HIV. This is trial and error. We tried this. This is an SMS Medical College. Both those drugs along with hydroxychloroquine was tried, and excellent results. But this is a case report.
So are we to understand then, Dr. Kukreja, that you're talking about that SMS Medical College in Rajasthan, that Sawai Mansingh Medical College in Mao, where hydroxychloroquine and antiretrovirals were used, and it had a good results with the Italian patients. This was in the early days of the COVID-19 breakout in India. Now, do you think that will not be applicable to another patient? Do you think other patients may not have the desired results with the same treatment?
The clinician clearly stated that we have given this drug because they were available to us. This is not to suggest that this is the line of treatment. And therefore, this is one of the way they manage their patients, and their patients survived. So, this is a reality what they stated, that we treated these 2 patients and they got all right with these medicines. But you can't take an inference that this is the treatment for people who are suffering from this disease. We are also doing similar treatment in almost every part of the country. But as yet, as has been mentioned by Dr. Sharma, that it takes time.
It takes time. Now, Dr. Madhumita, suppose a lot of people are asymptomatic, lot of people are asymptomatic because in a country of 1.3 billion people, we have only 10,000, as of today, we have only 10,000 cases. Now, a lot of people are saying, a lot of arguments, a lot of people are saying that figures are low because the level of testing is low. But I, as a layman, I have got a simple understanding of the situation. Suppose those people who are saying that India, the figure is less because testing is less, but if somebody is seriously affected, hundreds and thousands of people would have landed up at the hospitals. Absolutely. Because they would not have sat at home and, today the awareness level is so high, they may not have been tested, but they cannot sit tight at home. They would have definitely landed up in hospitals. Then therefore, people would have automatically had some figures. So how do you explain this? Because do you think asymptomatic people, they're getting cured even without any treatment?
Absolutely. 80% of the people are asymptomatic or have mild symptoms, where they have a small running nose and fever for 1 or 2 days and they get better. It depends on the age of the patient, as I said, and also about the existence of comorbidities. So the increasing the platform of testing, it's a little dicey because you might pick up too many positive cases also, and that might add into panic. So why? That, as we have already said, it helps in the development of herd immunity, because the group immunity is either by allowing the infection to occur in that subclinical level and getting cured and antibodies developing in the patients, and the second is by vaccination, which we have to wait for down the line, as Dr. Sharma has just mentioned.
Absolutely.
So there is no point in random testing, just test. Only when a patient is required to be tested, is sick enough, I think we need to test at this moment at least.
So for a layman, Dr. Kukreja, so lot of people in this country, or for that matter different parts of the world, lot of people may be having mild COVID-19 positive, but they are not doing anything, they are just getting cured on their own. Could that be also the case?
Yes, very much. Very much. People have the capacity. Every individual is born with a capacity to defend himself. Whichever with the virus, well, all people infected will not have the symptoms. As mentioned, 80% do not develop symptoms.
Absolutely.
Obviously, they will in due course of time, in 6 to 8 to 12 weeks time, develop a natural antibodies to them. So that is one. And there are so many things we have yet to learn. Let me very quickly say that today we are fortunate that we are in an era of electronics and social connectivity. Any message, anything happening anywhere is transmitted. We get our guidelines, we get our directions from ICMR, from WHO, and we know about our situation, global situation within moments. So hats off everybody, including the layman, is fully aware what is to be done, what is not to be done, and this is the excellent role played by the media, particularly visuals which have been shown how to keep social distancing, and this is what we are looking for. Without that, we cannot help our people.
Right.
Absolutely.
Absolutely. Yeah. Now, Dr. Rifat Mannan, when we are talking about that, at the end of the day, Rifat, a lot of people will be again thinking about the same question of which we began this discussion: when will the world get the better of coronavirus? So one way, we cannot have the world locked down forever. So there has to be an antidote and there has to be a vaccine. So how close is the world in getting a vaccine? What is your guess? Dr. Joyanta Biswa Sharma says that around January.
Vaccine for COVID-19. At this point, we need to know one thing, that before a vaccine is made available for public use, it has to go through a very strict protocol to ensure its safety and efficacy. And in fact, there are 3 phases of clinical trial that it has to go through before a vaccine is approved.
Right.
There are several candidate vaccines, and some of which has already entered into the phase 1, and it seems that it's another 12 to 18 months before a vaccine will be ready. And it's likely that during this outbreak, a vaccine will probably not be available. So till then, we have to adhere to all the social distancing protocol and hand hygiene before a vaccine is actually available for COVID-19.
Okay, viewers, again, this fact has been reinforced: maintain social distancing and maintain hand hygiene. Once again, viewers, we need to know that specialists around the world are talking about the same thing. Maintain social distancing, don't go by the figures. Strictly adhere to the protocol, maintain social distancing, and of course maintain hand hygiene. Now we are almost running short of time. My last question to you, Dr. Joyanta Biswa Sharma. Many are saying, I have asked this question to my other panelists, Indians have a better immunity. We have been given BCG vaccination, a lot of Indians, to fight tuberculosis, and that this is coming in handy today in our battle or in our fight against COVID-19. Are you among the buyers of this theory or this argument, Dr. Joyanta Biswa Sharma?
There are a lot of pseudoscience going on. This BCG vaccination thing is not a peer-reviewed paper. 2 gentlemen written up something and uploaded into a preprint archive. It is not peer-reviewed. Saying that BCG vaccination is protecting against COVID doesn't make any sense to me. Then what about measles? What about polio? What about hepatitis? There are so many viruses that BCG is not protecting. It is as good as saying like that Indians are more religious. That's why they are being spared by God. This is not science. But coming back to your general question that are Indians more immune, I think, if we kind of assume that there may be, we can probably argue that yes, Indians probably are a little bit more immune, because, if you go by survival of the fittest kind of analogy, the people who are surviving in a slum, by definition, they obviously, the weakest one are, they perished. It's survival of the fittest. So the natural selection kind of analogy, if you apply in a slum dwellers, for some dwellers, then naturally you can probably argue who reach their adulthood, perhaps they are the best specimen, So there may be some merit, but what is our main problem in India is that the density of population, the slums, the big cities, that is our main worry. But even then, virus is not taking hold in India. I think, to me, it is the humidity and temperature effect, because it is very pronounced that the epidemic is taking place between 30 degree and 90 degree north altitude north. and that is very pronounced. And we have to, kind of think that our climate is probably providing us some kind of benefit.
Climate is providing us some kind of benefit. Dr. Bharat Kukreja, final comments from you. You see, what Dr. Jantibhishra Sharma said, that we might be, who knows, India might be actually having slightly better immunity, because look at the number of slums that we have in this country, people living in very, very difficult conditions. If they can survive such kind of conditions, does it mean that they have a better immunity?
Obviously, they will have a chance to develop immunity because they are exposed from a very early age. As far as BCG is concerned, just for your information and information of viewers, it is given on the second day, and this is a live vaccine, and it takes pretty long time to stimulate the immune system. So, very early in a life, we expose and challenge the immune system with an antigen, and therefore antibodies develop. And probably that may be one baseline that the Indians have got a level of immunity which those who are not taking BCG, like people in USA, do not have. So, that might be one statistical or maybe one thinking, but that does not mean that we are more strong immunologically.
Absolutely.
We are, do not forget, we Indians are also nutritionally poor. So, immunity is directly related to nutrition. So, that is all hypothesis, all stories which we are learning, which are trying to find out. Thank you.
Okay. Dr. Rifat Mannan, I know you are a pathologist and not an astrologer, but I as a layman, I have to ask you this question once again before we part for this edition of Northeast Tonight. Any guess when is Corona going to get under control around the world? Once again, I am asking you this question. Any guess?
It is hard to guess the future trajectory of the disease at this point. As we know, in countries such as US, it is continuously on an upward curve, and we don't know when the curve will plateau or flatten. But there is some good news coming from countries such as China, South Korea, Taiwan, etc., that they have been able to control the disease, if not totally contain it. Unfortunately, however, there are also reports of new cases in places like Singapore, South Korea, and China when the restrictions have been eased out. So it's a cause of concern that there can be a resurgence of new cases with ease of restrictions, and one needs to be very careful about that. And how there will be the effect of season on the course of the disease, it remains to be seen. One can hope that with time, people will develop herd immunity and we will develop natural protection against the disease. And we can also hope that we will have a vaccine in due course, and that will give us some protection against the disease.
Okay, Dr. Rifat Mannan, let's all hope for the best and think that this will be a thing of the past. Dr. Madhumita P. Das, Dr. Madhumita, I want you to end with an assessment of the situation in Assam. We already have 31 cases, so how are we placed? We have a lot of facilities that we have built up very, very quickly in the last 3 weeks to 4 weeks, and we have 31 cases. How do you wrap up the situation in Assam? We'd like to wrap up with this assessment of yours.
Thank you for giving me the chance to wrap up the situation. It is a huge gratitude to our government, to our health minister. The way he is leading us, the way he is guiding us, just follow him. He is doing the best possible a human can for the state. And lockdown, 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 and social distancing, hand washing, that is the message of the day, and that's how we can control and contain the disease.
Absolutely, viewers, this is the situation in the world. There is no need to panic. Medical specialists around the world, microbiologists, virologists, and all medical specialists from different fields are working round the clock, both to battle the disease as it unfolds and of course also to prepare a long-term antidote to tackle COVID-19 or coronavirus, and that antidote obviously I'm talking about is a vaccine. And if we take our Prime Minister's message address to the nation today, where he asked the young scientists to rise to the occasion, help not just Indians but the world community at large, and he also asked them to work on a medicine, I would like to stick my neck out and say that perhaps India is also working very hard and in order to make a vaccine, and we would definitely like to beat the world with the coronavirus vaccine. On that hope, we end this edition of Northeast Tonight. I thank all my panelists for participating in this very engaging discussion, and the viewers for watching the program. Good night and goodbye.
Thank you, Wasbir.
Northeast Tonight, brought to you by Oil India Limited, conquering newer horizons.